In 2010, the AstraZeneca HealthCare Foundation established the Connections for Cardiovascular Health program with a $25 million contribution from AstraZeneca Pharmaceuticals. The program has provided grant funding for innovative community and clinic-based programs aimed at improving cardiovascular health across the United States.
According to the American Heart Association, over 85 million Americans are afflicted with cardiovascular disease, and that's why we decided to try to improve cardiovascular health by supporting, through grants, grassroots community organizations that are trying to improve heart health in their communities, one heart at a time.
At the AstraZeneca HealthCare Foundation, we believe that it is vital for successful grantees to share their knowledge, strategies, and innovations so that others can follow their lead in addressing the burdens of cardiovascular disease in the United States.
AstraZeneca HealthCare Foundation, they provide such exceptional leadership, and they are so committed, and it's saving lives in our clinic. I can tell you, I can promise you on a daily basis.
I've changed, and HealthRight is responsible for that.
From the collective work of the Connections for Cardiovascular Health grant awardees and the Foundation's university evaluation partners, 6 innovative approaches emerge as effective methods for delivering successful community-based cardiovascular health programs.
Everybody deserves to have access to care, knowing that heart disease is our #1 killer and prevention is huge. And I hope we can make a difference in a lot of lives.
Well, it's not too often you get anything free in the world, so it's an opportunity to get some health screening that I wouldn't otherwise have.
Oasis is a nonprofit that caters to adults 50 and older. Everything is free, and we're bringing it to where they live, work, and play.
Tuck those abdominals in.
It's self-management, taking control of your life through what you learn about your body. We are just kicking what they used to call old age.
Let's go. 1, 2.
When I heard about this program and what it had to offer, I said, now this is a good chance for me to just really get in there and try to do something. And what it has taught me is to how to manage the stress level, my eating habits, and I just feel great about it. I'm excited about the program.
People come, they trust you here. Empowering people within the faith-based community is powerful. You can really change a community.
It's really more about families than it is about individual populations. We try to, of course, serve adolescents and adolescent health, but also their families and the vulnerable adults in those families as well.
The kids come in and learning about No Hearts Left Behind so they can communicate with their parents about eating healthy, and their parents bring it to the community.
It has completely changed our lives.
I had the opportunity to learn about the importance of eating whole foods, especially for kids that are still growing and need to use their brains to get good grades in school. That's why I have all A's this quarter.
What this grant has provided for us is the opportunity to build capacity in our organization so that we can be sustainable and continue to work with our community and make it better.
I couldn't afford to go to a doctor, so I came to Catherine's Care. I was 403 pounds. My blood sugar was 255. My blood pressure was 155/70, whatever it was. It was very bad. Today, my weight is 250, and my blood pressure is 124/80, and my blood sugar as of yesterday was 95. I did not want to die. I wanted to be healthy so I can raise my son.
Across the country, heart disease and cardiovascular disease is the #1 mortality issue amongst Native Americans. And so we have really tried to focus on creating what we're calling a culture of wellness. And so hopefully we'll get people towards that, thinking of becoming well again.
I just love the life of being physically fit. I want to reach that fourth ridge to be an elder someday.
If you can get one person into class, they basically become tools for their families and their friends, and everybody that's around them, they pretty much become stronger in so many ways. Mentally, spiritually, emotionally, and physically, they get stronger.
Since we've launched the Connections for Cardiovascular Health program in 2009, we are seeing good results. People are changing their behavior. This is our mission, to try to improve cardiovascular health throughout the country, one community at a time, one person at a time. And we're getting it right year on year, and these programs are having an impact.
By sharing lessons learned, we hope to help others improve heart health in their communities.